Hello, everyone, and welcome to another edition of the Empowered Patient Podcast, where medical disruptors, insiders, patient advocates, and more come together to improve healthcare, particularly for cancer patients. Today, I am honored to interview Dr. Malinow. He is a Baltimore-based internist and a concierge medicine pioneer with over 2 decades of experience. He works with MD-VIP and is the Director of Education and Clinical Excellence. He is board certified in internal medicine and one of Maryland's few dual-certified hypertension and lipidology specialists. He's a member of the prestigious Alpha Omega Alpha Honor Society, and he has earned numerous accolades from 11 straight years on Baltimore's top doctor list, as well as being named a top concierge physician nationwide. Join me in welcoming Dr. Malinow, known to his patients as Lou. Hi, everyone, and welcome back to the Empowered Patient Podcast. I have a very interesting guest today that I was very thrilled to have met through LinkedIn. We met each other, I believe.
Maybe.
I think so. So this is Dr. Lou Malinow, and he is an expert in hypertension and lipidology. And I can't wait for him to tell us all about that. And so without further ado, would like to start speaking with Dr. Lou. Hi, how are you today?
Great to be here. Thanks for asking me.
Thank you so much for being here. So tell me a little bit about your practice.
So I'm an internist by training, trained out in Palo Alto, California. Been in practice 28 years. For 11, I practiced traditional medicine, 25, 30 patients a day. The last 17 years, a concierge style practice with MD-VIP. And, years and years ago, certified as a lipid expert, cholesterol expert. So cardiovascular prevention is probably my expertise. But have really gravitated to a health span oriented practice. I think we all need to really do everything possible in our power to make the last 10 years of our life robust and enjoyable, because we just see people falling apart in the last 10 to 15 years of their life. And in large part, that's preventable with the right types of changes early enough.
So that's very interesting. So many questions I have about everything that you said. Let's start first with your transformation from traditional clinical medicine to concierge practice. What did that look like for you?
So my dad and I practiced together forever. My dad, would see the same number of patients, 25, 30 patients a day. We were seeing people in 15-minute increments, and he was always happy. But after like 10, 11 years, I just wasn't happy. I needed more time. My patients needed more time. And this was the only way to do that. So it was a win-win. And after a 4-month transition, we actually did it together. I talked my dad into doing it. And it was great. So since I opened, I've had a full practice, and I can spend 2 hours with somebody now.
Wow.
And really what it gave me time to do is not put out fires, but keep them from starting.
Sure.
So, and you need time to talk food, to talk exercise, to talk heart, dementia prevention, early cancer detection, because we don't know how to prevent cancer quite yet. That's your world. Metabolic health is huge. It takes a long time to fix everybody's metabolic health. So it's a time thing, and it's been amazing.
That's phenomenal, really. And I admire you doing that. And I'm sure your patients are all so grateful for the time and in-depth information that you gain from them and the relationship that you form. And you had mentioned before we started about how nobody calls you Dr. Malinow in the office.
Yeah,
they call
Malinow. Yeah,
Malinow.
No, I won't let my patients call me doctor. I mean, I want to be on the same level as my patients. We're making decisions together. We're just chatting like you and I. Yeah, I'm not up here and they're down here. We're the same. I'm just doing my job.
That's a novel concept in clinical medicine. I can say that for sure.
Yeah, my dad was the same way. Everybody called him Stan. So
That's great.
Yep,
That's really wonderful. And you get to such a deeper level of communication as well as understanding of a patient when you can broach it in that way.
I think the long, enduring, trusting relationship is what this is all about.
Sure.
You see people sometimes on the worst day of their life. And if they've got somebody that's just clinical, impersonal, not friendly, doesn't really spend the time, it's scary. It's even scarier. But when you've got somebody you trust that you've spent a lot of time with, it's amazing,
Yeah. And the level of trust and empathy
huge.
is amazing. Sure.
Yeah,
So,
yeah.
Let's talk a little bit more about your longevity and about the metabolic health that you were talking about. And, in particular, as you know, a lot of my listeners are either cancer patients, cancer survivors, cancer previvors, and or they're healthcare advocates. And so, that whole concept of longevity is important. But I think if we back it up a little bit as to the root cause of what you're looking at, it would probably mean a lot to these patients because although they are planning to live a long life, when you have a cancer diagnosis, knowing that you're going to live till 80 years old is a little difficult, obviously. So we often try and stay closer in the moment. So how do you work with patients that are really need the here and now from you?
Yeah, I mean, look, when I longevity is a weird word,
Hmm.
but I just think about living as long as you can, but as healthfully as you can, because
Right.
the healthy part of our lives too often end early in America, especially. You can live to 80, but if the healthy part of your life ended at 55 or 60 and you're struggling through the next 20 years with chronic diseases,
Hmm.
that's not the way I want it to be for my patients.
Sure.
So the earlier I get a hold of somebody,
Mhm.
the better. Like if I could get a hold of people when they're 20, I can't make any guarantees, but I can almost guarantee they're going to do better if they do the things that we talk about.
Sure.
So the big buckets I think of if you're trying to live your best life and go as healthfully as long as possible are you have to have perfect metabolic health. You have to prevent heart disease, which I think if we get a hold of somebody early enough and do the right tests, 100% preventable. I've not had a heart attack in my practice in 15 years. Um, Cancer, again, look, there's four things you can do to not get it. Don't drink too much, don't smoke, don't get sunburned, and stay metabolically healthy. Because obesity is now, or metabolic problems
Hmm.
are now the number two cause of cancer behind smoking.
Hmm.
Um, and we can talk about early cancer detection. And then we don't have a drug yet to treat dementia. So there's a saying in the dementia prevention space, dementia prevention isn't just the best thing we have, it's the only thing we have. And there are a bunch of things people can do to protect their brain
Hmm.
because it's one thing to be healthy physically, but if you're cognitively unhealthy, you need physical health, cognitive health, and good emotional health. And that's about relationships and sleep and other things. So those are the big buckets: metabolic, heart, cancer, dementia. Immune health is probably important.
Hmm.
Hormonal health, very important.
Sure.
So like your population might be, with your expertise,
Hmm.
maybe hormone replacement therapy isn't a thing that a lot of women can do who are facing breast or ovarian. But
That's a hot
everyone,
button topic right now.
oh, totally. My opinion on hormone replacement therapy is every eligible woman at perimenopause should be on hormone replacement therapy until the day she dies. So,
You
but
heard it here.
there's caveats,
Right.
so, and that
Sure.
includes not just estrogen and progesterone, testosterone
Mm.
is a game changer for women.
Mhm.
So I'm
Mhm.
maniacal about doing that for women who are interested. Uh,
Mhm.
Libido, bone, muscle, brain. I mean, testosterone can really be a game changer.
Mhm.
So,
Wow.
but it's
Wow,
not
so much.
approved. You have to compound it. So,
Right.
um, but yeah, the
Right.
metabolic, I think,
Yeah.
that's the one thing. Like, not everybody has heart disease, dementia, or cancer. But if you look hard enough, 92% of America is metabolically unhealthy.
Mhm.
And looking hard enough doesn't just mean getting a fasting blood sugar and a hemoglobin A1C, which most people listening to this will have had.
Right.
So if you look at your fasting blood sugar, the lab says under 100 is normal. Really awesome is 90 or lower.
Right.
Because the 99 wouldn't be what I'd consider perfect. And
Right.
even though a hemoglobin A1C, which is a 90-day average blood sugar, is
Sure.
considered normal below 5.7, really normal's 5.4 or less.
Mhm.
To anybody that's above those numbers, I'll dig deeper. And everyone in my practice gets an insulin level, a
Sure.
fasting insulin.
Band system. Yep.
Yeah, and if you look at the lab, it'll say it should be under 18. It
Mhm.
should be 9 or less. And
Mhm.
people that are doing everything right,
Mhm.
5 or less. So my rock stars will come in, they're exercising 5 or 6 days a week, they're eating a totally whole, real food, unprocessed diet. They're walking in with insulin levels of 2, 3. And look, as well as I do that a lot of cancers have 6 to 10 times the number of insulin receptors on their
Mm-hmm.
surface, especially breast
Mm-hmm.
and colon, and
Mm-hmm.
and you just don't want to be eating a high sugar, high carbohydrate, ultra processed diet if you're
Sure.
looking to do the best you can to prevent cancer. Um, and anybody that's not metabolically perfect, A1C of 5.4, fasting glucose of 90 or less, insulin below 9, gets a continuous glucose monitor. Because that, and I know diabetics, of course, use them. I have tons of healthy patients using continuous glucose monitors because in 10 days or 14 days, you can identify what your kryptonite is, which in my world is anything that spikes your blood sugar greater
Mm-hmm.
than 140 1 hour after you consume it. And that,
Interesting.
yeah, and it's different for everybody, which is wild because it has to do with your gut health and, just your physiology. Like I don't eat bread, bagels, for the most part, stuff like that. But fruit is like my kryptonite, certain fruits. So I know
Mm-hmm.
grapes, bananas, the two highest sugar fruits, absolutely rocket my sugar. So I just steer around them and stick with berries and green apples and things that don't touch it. So
Sure.
it allows us to sort of customize, and patients like instant feedback,
Yeah.
so it's
So how does
kind of
how does a patient get one of these glucose monitors? Do you need a prescription for it?
you used to, and a Dexcom, which is what all the type 1 diabetics wear, used to
Mm-hmm.
be like $300 a piece. Now you can go on a website, Stelo.com, and for 99 bucks, you get two. So it's 49 bucks a piece, direct to consumer. It's the app is free. You download the app, you plant it on your arm, 24/7, you can see what your blood sugar is. You can
Wow.
see it overnight. And it's a game changer because it's instant feedback. And holy cow, I just ate this whatever, and now my sugar's 160. I
Yeah.
better limit or avoid that. And
Sure.
when people do that and the right things with exercise, metabolic health always improves. And
So
like it just empowers the patient, which is your podcast.
of course,
So,
I
yeah,
really like that, and I will put the information about that in the show notes as well for anybody that's
perfect.
interested
Yeah,
in buying one of those. I think I'm going to get one for myself, Lou. I
yeah,
think
awesome. Yeah, look, you're
so.
human. Yeah,
Yeah. Oh, yeah. Um, uh, as I say to my children, do as I say, not as I do. But I'm
totally.
working on it. We're all working on it.
Yeah.
So everything's a work in progress. So here's an interesting question that I want to talk to you about that I think is a very big myth out in the oncology world is that, and I think we kind of touched on this, but I want you to clarify it for our audience. Does sugar cause cancer?
So I don't know that sugar causes cancer,
Right.
but I think if it makes you metabolically unhealthy, if you're consuming enough sugar
Hmm.
to have high insulin, a high hemoglobin A1C,
Right.
then we know that that fuels cancer.
It's
Does it cause it?
the insulin spikes more
It's the
so than the
insulin, because
glucose. Yeah.
insulin is a growth factor.
Right.
So yeah, absolutely. It's insulin like growth factor.
Right.
You know, Once you have a cancer, that's lighter fluid. If you're metabolically unhealthy and you have a cancer, that's lighter fluid. Is it the match that starts it? Probably not, because I think we need some mutations to start
Sure.
driving a cancer, but I just think nobody's going to go wrong getting rid of any liquid sugar and ultra processed foods and sticking
Hmm.
with real food. And a real
Yeah.
food for your audience is a food that does not need an ingredients label. Meat, fish, chicken, turkey, nut, seed, fruit, vegetable, egg, Greek yogurt. No ingredients label. It's a real food. Everything else in a box or a bag? No. So,
That's
like
tough.
cereal used to be wheat, but now it's wheat plus 24 other things. And that's not a
Right.
real, that's a food like substance.
Right. Right.
So, yeah.
That's
So,
tough.
yeah.
That's tough
I don't,
though. That's a tough diet. You have to really be prepared.
It's you do. And look, if your audience is primarily, women between 30 and 65 who have had a cancer, they know that sometimes you get a PET scan for cancer. Well, how
Sure.
do they do that? They take your blood, they label the white cells with sugar, they re-inject it and follow the sugar. Where's
Right.
sugar go? Goes to
Right.
cancer.
Well,
So
it
you
goes
just
to
want to really
rapidly,
good.
yeah,
Yeah,
metabolizing things. It goes to
yeah, exactly.
infections and to surgical inflammation as well. But yeah, I mean,
Yeah.
definitely. But sometimes what I try to tell my patients, although I like this idea with the blood glucose monitoring, I haven't instituted that yet, but I usually tell my patients and we'll print out a diet that's euglycemic, meaning
Yeah,
that foods that you can eat that don't spike your blood sugar, as you had mentioned
exactly.
before, like berries are much better than a banana,
Absolutely. Yeah.
and
Yeah, a whole
apples better than
banana.
apple juice, right?
Oh, definitely. Yeah, if it's
Right,
real food, like, yeah, I don't consider fruit a problem usually because it's got water, it's got fiber, it's got
right.
micronutrients. Yeah, but yeah,
So I want to switch gears for a second. Can you talk a little bit more about the role of diabetes, metabolic health, and development of dementia? Because I think that that's also something that all Americans are really need to take a look at, especially if we don't know what our ApoE gene profile is. Perhaps everybody needs to be looking forward speaking to make sure that they're preventing dementia, which they now call type 3 diabetes, right?
100%. Yeah, so there's so many things people can do to prevent dementia, but the number one thing that anybody can do to protect their brain by a mile is
Mm,
regular exercise. And we have studies showing that if you're a couch potato and you get a brain MRI and your hippocampus, the memory center that sits on each side of the brain,
hmm
um, you then start to exercise and re-MRI a year later. The hippocampus is massively improved in terms of size. And this is one thing where size matters. The size of your memory center equates to how well your brain functions.
hmm
So exercise is number one. Sleep, I consider number two,
hmm
because the brain cleans itself at night.
Right.
We all build up this debris and detritus over the course of the day while our brains are active. And the brain is kind of like New York City. New York City gets dark at night, quiets down, the street sweepers come out, clean up the streets.
That's a
Same
good
thing happens
analogy.
in the brain.
Sure.
And only in the brain, it's sort of those early stages of sleep where you get this flush away of all that debris and detritus. So
Mhm.
7 hours minimum sleep if you're really trying to optimize brain function.
Mhm.
And then, the type 3 diabetes, make sure your insulin, your fasting glucose, your A1C are perfect. And that could be dietary changes, that could be crushing it with exercise. And there's one specific workout that absolutely lowers A1C better than anything. I can talk about that in a minute if you want.
Absolutely.
Um, Keep your blood pressure normal, which
Mhm.
is 120s. Cholesterol definitely needs to be normal to protect your brain because the brain is full of blood vessels. High cholesterol increases dementia risk. There's some caveats with how you have to lower cholesterol in people who have that ApoE4 gene you
Mhm.
were referring to.
Mhm.
I do check ApoE4 selectively,
Mhm.
and that's a gene that 2/3 of people who go on to develop Alzheimer's have.
Yeah.
You get a copy or two from each parent. One copy, 2 to 3-fold increased risk. Two copies, 12-fold increased risk. The only thing that changes is those people have to be crushing exercise. They have to be flooded with fish oil because they have a hard time getting it into the brain. That's one of the ApoE4 problems. And
Interesting.
those are the people who need to avoid high dose statins. And there's a blood test you can do to tell when someone's on a statin, is it potentially lowering brain cholesterol too much? I
Mm.
run that test all the time.
Mhm.
I won't do it on a low, like somebody's on a low dose statin, it's not necessary. High dose, especially if they have ApoE4, I always run it.
Interesting.
Because then you have to back off the statin and use other things to nudge the cholesterol down. There's a bunch of supplements I like for dementia prevention.
Mhm.
Vitamin D,
Mhm.
treated to a level of 40 to 80.
Okay.
Omega 3s, I do a blood omega 3 level on every patient in my practice every year.
Mhm.
And you want that DHA nice and high. Turmeric. There's a brand of turmeric that has a randomized controlled human trial showing that it improved verbal memory statistically significantly in 18 months.
Wow.
It's called Theracurmin HP for the listeners.
Theracurmin
Creatine.
HP.
Yep,
Really
creatine is an amazing brain and muscle supplement.
interesting.
Um,
Okay.
and data's flooding in, and anybody who has a high homocysteine level, which
Yeah.
is an easy blood test I do every year on everybody,
Right.
super easy to lower with methylated B vitamins. So
Right.
those are the 5 supplements. Sauna, an amazing brain
Mm.
and cardiovascular prevention tool. 2 20-minute sessions, 31% reduction in dementia. So,
With just a sauna, a dry sauna or a wet sauna?
so the most of the data is out of Finland with 174 dry saunas. Dry sauna heats the air, so you get heated from the outside in.
Mm,
Infrared sauna, which is what we've had in our house for like 6 or 7 years, heats you more like a microwave from the inside out. So the heat's not as high. It's like 135, 140, but I'm in there sweating buckets, so I know it's working. Um, so yeah, there's just so many things you can do to protect your brain because we just don't have a drug to treat this nightmare condition yet, which is
sure.
just sad. So we'll get there, but we're just not there.
So I like that you test the omega-3 levels.
Yeah.
And for our listeners, a lot of the supplements that are out there also have omega-6 in there. And my understanding is that you're supposed to be try to favor the omega-3. And so should your supplement not have omega-6 in it?
Most of the good ones are not going to have any omega sixes.
Mhm.
Some will. Really, like if you go to Walgreens, Rite Aid, wherever, not to pick
Right.
on them, they sell popular brands,
Right.
Nature Made, Nature's Bounty, things like that. So every fat, whether it's a fish oil or fat from meat or cheese, the saturated fat has three fats. They're called fatty acids.
Mhm.
Nature Made, one of the three is fish oil. The other two are saturated fats. So it's a
Eh,
great way to get saturated fat and calories, but not a great way to get fish oil.
Okay.
So I have brands that I really like where I know
Sure.
at least two are
Mhm.
omega 3s. They work a lot better. If you want to get one that has all three,
Mhm.
prescription. So,
Interesting.
but
Okay.
not covered without meeting certain criteria, and it's stupidly expensive.
So
So,
what are the brands that have the 2 in it that you like?
so the ones I like are Carlson makes
Mhm.
something called Elite EPA Gems. Not cheap, but really quality. It's as
Mhm.
good as the prescription stuff, in my opinion. And then Pro Omega 2000 from Nordic Naturals is another brand I really like.
Great.
Um, yeah, so just for the
I'll put those
listener.
in the show notes too. That's wonderful.
Yeah, yeah.
Yeah, okay. So that's really interesting stuff. Now, there's a new medicine, and the reason I'm interested in it is because looks like it may have some benefits in terms of treatment for breast and prostate cancer. So there's an injectable anti-cholesterol medicine that works specifically on lipids. I was looking it up the other day. Can you
So
help?
the
It
in,
starts with an E. Iconistat.
so there's the injectables that are in use in my world are the
Right.
PCSK9s,
Yes.
Repatha, Praluent. There's inclisiran, which is Leqvio. That's an every 6 month injection.
Okay.
And Evkeeza, could that be the one you're thinking of?
I think it's the first one you said, the
PCSK9s?
PCSK9s. I was just reading an article about how, it's not FDA approved for this, but it does look like there are receptors on breast and prostate cancer cells that are improved with, I don't know the whole pathway. Maybe you could talk about it a little.
Yeah, so honestly, this is new to me. I wasn't aware that it had
Oh,
any benefits with
uh-huh.
cancer.
Okay.
But as soon as this is over, ChatGPT is getting a visit from me. Um, but yeah, basically, I mean, PCSK9s for your audience are like we normally try to get cholesterol down in somebody who needs it down with,
Right.
statins or another pill called ezetimibe or something else called bempedoic acid. But when pills are not getting it down, or a person's at really high risk and we just need to get their numbers even lower, we give these injections called PCSK9s, which just, all the drugs work by increasing the receptors on the liver that
Mhm.
pull LDL cholesterol particles
Mhm.
out of circulation.
Mhm.
The PCSK9 injections just do it so much more robustly than statins, and they're incredibly safe. And statins, cholesterol in circulation
Right.
never gets into the brain. Your brain makes all of its own cholesterol. None of the cholesterol in circulation gets into your brain. Your brain makes all of its own. But statins can get across the blood-brain barrier.
Okay. Uh-huh.
And if they get into the brain, they can lower brain cholesterol.
Which is
So
not good.
that's just statins, not good,
Right.
especially in an ApoE4 carrier. But
Mhm.
PCSK9 inhibitors don't do that. They're completely safe for the brain. Um, so yeah, so I'll check out the cancer data. The fascinating drug that's around the corner that's finishing its studies is a new cholesterol pill called obicetrapib. And
Say that 3 times
obicetrapib,
fast.
it's coming. It is really fascinating because not only does it lower cholesterol massively, triglycerides, it raises HDL for whatever that's worth, but it may have a role in dementia prevention. Because in people who have the ApoE4, one of
Hmm.
their problems is they can't deliver cholesterol to neurons, brain cells, and they can't take cholesterol out of a brain cell. Because if a cell gets overstuffed with cholesterol, it doesn't work properly. And so this drug increases a little protein. I don't want to get too complicated, but a little protein that can get into the brain, take over for that
Hmm.
ApoE4 that ain't working properly.
Right.
It's wild. So
That's
um,
amazing.
it's coming, and it's supposedly it costs like $30 a year to manufacture.
Oh,
So
wow.
it's yeah,
So that
I
means
don't
it'll cost $250,000 a year to buy it.
probably, big pharma. So we need
We'll
them.
figure out how to make it expensive and
We love them, but
inaccessible.
we hate them. Yeah.
So
So yeah,
true.
yeah,
All right.
yeah.
This has been what an education, just not just for me, but for my audience. And wow,
Yeah.
fabulous. I was so grateful when you decided to join me on this podcast because I knew you had so many interesting things to share. What haven't I touched upon that you think would be really interesting for my
I
listeners?
think I think like when a patient goes to a traditional doctor and they're trying to drop weight, it's eat less, move more, right? But they don't really have a plan. I mean, how are you going to do that? Because
Right.
you can't just eat less, or we don't things don't work that way.
Right.
So I think the two things I would mention to your audience are, with diet, we talked a lot about sugar, but people that want to live their best life in the last decade or decade and a half of their life, they got to step into it with as much muscle as possible because muscle is the organ of longevity. You know, and look, nobody dies of weak arms. Having great arms, great pecs, six pack, okay, you get a date. But you want to stay off the floor, you better be hitting your legs hard. And
Right.
so I think to really maximize muscle, if you're doing the right things in the gym, you got to hit your protein target every day.
Which is
And
hard.
too many people, especially postmenopausal women, because I take care of a ton of them, are not hitting anywhere near where they need to. So everyone who's listening who has normal kidneys, in whom it's safe, they should be aiming for as close to 1 gram of protein per pound of their goal weight. So let's say you weigh 150, you want to weigh 130.
Hmm.
130 grams of protein a day is your goal. And I usually think in 30-gram increments of protein
Okay.
because until you hit about 30 grams at a serving, you are not going to put muscle on.
Mm.
So 30 grams of protein for the audience is about 5 egg whites. It's 5 ounces of pick your animal. So chicken, turkey, fish, meat. And 5 ounces is little.
All right.
Most people are eating like 8 to 10 at dinner. So they're getting 50, 60 at dinner. A
Weight
cup and a
Watchers
half.
used to teach us it had to fit in your palm.
Exactly. Yep. That's about 5 ounces.
There you go.
Um, and then a cup and a half of Greek yogurt. It's 5 ounces. A cup of cottage cheese. And I use a ton of protein shakes in my practice
Mm.
because so many people now are just eating 2 meals a day. But it almost always, unless you weigh 100, 110 pounds, you
Right.
usually need 4 protein servings a day to get anywhere near your goal.
Hmm.
So nobody's eating more than 3 meals. So that's 3 meals and a shake
Right.
or, whatever. Um,
And you have
and
to tell
then,
us which shake, Lou.
oh, I mean, if you want easy,
Easy.
there's Fairlife,
You
you
think those are
know,
good? I thought those were good for you.
I mean, look, that's why I said easy, not
Right. Okay.
perfect.
Okay.
Easy, because Fairlife makes a 30 and a 42-gram protein
Hmm.
shake, but it's got no sugar. It's
Hmm.
got a couple extra ingredients, but I would call that a minimally processed food
Hmm.
versus like a bag of Doritos, you know, ultra
Right.
processed. So
Sure.
there's a difference. Premier is another one that has 30. There's Core
Okay.
Power. There's a bunch. And then there's plant-based protein shakes for people that are vegan or vegetarian. And then, if you want to be a purist, you make your own, and whey protein is probably a little better than most other types of protein. Um, and then I don't know how detailed you want me to get about exercise, but I mean, I can try to, I'll just show you a picture if that's all right, if I'm able
Sure.
to
I would
screen
love to.
share.
Of course.
There's 3 types of exercise I talk to my patients about, and each of them does something different.
Hmm.
So there's zone 2 exercise.
Right.
So So zone 2 is what we call your fat burning zone.
Right.
And people that are lean mean machines, twice a week is enough.
Hmm.
30 to 45 minutes going hard enough where your heart rate is about 180 minus your age. So if you're 50 years old, a heart rate of 130 is your
Mm,
zone 2 intensity, which
okay.
shouldn't be tough. You can
Right.
still talk, have a conversation, and you know you're in zone 2 when you can close your mouth and still get all the air you need out of your nose. So, so that, as long as you can breathe out of your nose.
People also say as long as you can comfortably hold a conversation, right, when you're walking.
Exactly. Yeah,
Yeah.
if you can
Yeah.
still talk, the person you're talking to is going to know you're exercising. Like I'll sometimes make phone calls to patients when I'm zone twoing for 45 minutes twice a week.
Uh-huh.
So anyway, that's zone 2, and that just keeps that fat burning machinery alive.
Sure.
No less than twice a week, especially postmenopausal women who probably should do it more.
Mm,
They should be strength training, lifting weights, and really focusing on legs and making sure that you lift enough weight so that the last couple reps of every set are tough.
mm,
Because if you're just lifting 10 pounds and you do 10 or 12 reps and you
right.
could do another 10 or 12 without a break, you need
Mhm.
more weight. So, and that plus the protein, you're definitely putting on muscle, everything in your life's going to improve.
Right.
And then once a week, and people who can, people that really want to take a bite out of their insulin, their glucose, their hemoglobin A1C, I ask patients to do what's called a zone 5 workout. So a zone 5 workout is intervals.
Mhm.
It's 3 minutes hard enough to get your heart rate to 220 minus your age,
Mhm.
take off about 10%. So let's say you're 50. So 220 minus 50 is a heart rate of 170.
'Kay.
Take off 10%, heart rate of 153 or higher.
Mhm.
And so in that's 3 minutes at that intensity, then
Uh-huh.
3 minutes super easy. Back and forth four
Interval train
times.
interval
Yeah,
training,
so
right?
exactly. Three hard, three easy, four times, 24 minutes, once a week. And you should be in the pain cave doing this. That's how hard it should be. And if you do that once a week, that took my hemoglobin A1C in 3 months, 4 or 5 years ago when I started, from 5.3 to
Mhm.
4.8. And it has been at 4.8. And
Wow.
I'm almost 58. It's kept it there for the last 4 or 5 years, just that once a week. And that allows you to get away with more indulgence, like a little
Mhm.
more carbohydrate, because that burns through all the stored sugar in your muscles, which is where 85% of your sugar is stored. And I
Wow.
tell my patients muscles are a sponge. You spill
Mhm.
orange juice on the counter, you want a big sponge. Like if you've got a little baby sponge, you can't mop
Right.
it up, right?
Right.
That's the
Right.
muscle, bigger sponge. And aerobic exercise is wringing that sponge out. Because if you got a saturated sponge, all the sugar you ate is heading to the liver and turning into fat. And this is why a third of America has fatty liver now.
Mhm.
So,
And it's
so yeah, I
not, and
just
so
think that
that's interesting because I think a lot of people would think that it's fatty liver because they're taking in too much fat consumption, but it's actually sugar that causes the fatty liver.
100%. Yeah,
Yeah.
when you eat, 85+% of your sugar heads to muscle. And if you're doing the right things, that sponge is empty and big, and you sop it right up. But if that sponge is small or full, it's heading to the liver, and the liver takes sugar and it turns it into fat. Because muscle has a very large storage compartment for sugar. The
Mhm.
liver, it's small, it's a little
Mhm.
closet. Once that's full, the rest gets turned into fat, and then it gets spit into circulation. And that's why people have triglycerides that are high. And high in my world is above 90. The lab will say 150, but if your triglycerides, if you look at your labs, are
Mhm.
over 90, you
Mhm.
probably have a fatty liver. And you
Wow.
either need to cut down alcohol, carbohydrates, or start crushing it in the gym, because all three will improve it.
This has
So,
been such an education. Absolutely fascinating information. I'd love to have you back. There's so many more things I want to ask you about. I
yeah,
really
no, definitely.
I'm so grateful that you joined us actually, and I just can't thank you enough. So, I'm going to let you get back to your
Perfect.
Friday and enjoy your
Yeah,
weekend. And thank you everyone for tuning in, and we will be back next week. Thank you so much. Bye-bye.
thanks so much.